Welcome to Emergency Medicine 101. Today, we're going to be diving into an extremely important topic, basic life support, or BLS. This knowledge could make a difference between life and death in an emergency situation, so I encourage you to pay close attention. Basic life support, often referred to as BLS, is used in life-threatening situations. It includes procedures and skills such as chest compressions, rescue breaths, and the use of an automated external defibrillator to help maintain someone's breathing and heartbeat until they can receive full medical care. This is the first step in a chain of survival that can save lives during cardiac or respiratory emergencies. BLS is deployed in situations where an individual is experiencing cardiac or respiratory arrest. Cardiac arrest occurs when the heart suddenly stops beating. These patients will be unconscious, without a definite pulse, and they will not have normal breathing efforts. At times they might have agonal or abnormal breathing patterns. Whereas respiratory arrest is a condition in which breathing stops but heart's function continues. So, the patient will be unconscious, with no breathing efforts but will have a definite pulse. The thing to keep in mind is that respiratory arrest will be closely followed by cardiac arrest. So early recognition of respiratory arrest and quick application of BLS can be a lifesaver. It can help maintain a flow of oxygen-rich blood to the body's vital organs, buying precious time until more advanced medical help can arrive. Remember, every second counts in these situations. Now that we learned when and where to apply BLS, let's see more about how to apply basic life support. The steps of basic life support are as follows. 1. Ensure scene safety. Always ensure that the environment around the patient is safe for both you and the patient before starting BLS. 2. Check for response. Tap the patient gently and ask loudly if they are okay. If there is no response, they may be unconscious. 3. Call for help. If the person is unconscious, call for emergency medical help and to bring an AED device immediately. 4. Check for pulse and breathing. Look, listen, and feel for normal breathing and carotid pulse for no more than 10 seconds. If there is no pulse, start chest compressions. 5. Chest compressions. We will discuss more about it later on. 6. Rescue breaths. After 30 compressions, give 2 rescue breaths. Tilt the person's head back slightly, lift the chin, and breathe into the person's mouth for 1 second, ideally with the help of a pocket mask. Make sure there is enough breath to make the chest rise. Presently it is not necessary to give rescue breaths if the caregiver is uncomfortable with it. 7. Repeat. Continue cycles of 30 chest compressions and 2 breaths until help arrives or an automated external defibrillator, AED, is ready to use. We need to perform high-quality CPR. So, what makes your CPR high quality? It depends on site, rate, depth, technique, CPR being uninterrupted, and lastly to avoid excessive rescue breaths. Let's look at it one by one. The site should be at lower sternum, at nipple level. At rate of 100 to 120 compressions per minute. To a depth of 2 to 2.5 inches or 5 to 6 centimeters in adults. For proper technique, you need to make sure your hands are positioned correctly. You place the heel of your non-dominant hand in the center of the chest on the lower half of the sternum. Your other hand should go on top of the first, interlacing fingers. Your shoulders should be directly over your hands and your arms straight. This position allows you to use your body weight to compress the chest. It's important to allow for full chest recoil after each compression, to let blood flow into the heart. The chest should rise completely after each compression. Remember, it's crucial to minimize interruptions in chest compressions. If at all, keep interruptions to a minimum of 10 seconds and try to give CPR continuously for a duration of 2 minutes in between interruptions. Rescue breaths should be given at a rate of 1 breath every 6 seconds, when the patient is intubated. Now let's look at a scenario. A 50-year-old male collapsed at a marriage function. On examination he is unconscious, has no pulse and there is no visible chest rise, being the only doctor in the function. How will you approach the scenario? So, first things first, ensure that the scene is safe, that is, have a quick glance of the surrounding, move the patient to a more secure location if he is surrounded by broken glass or any sharp materials. Tap on the man's shoulder. Call out his name and check for his response. Since he is unresponsive, immediately call for help while simultaneously checking for pulse and breathing efforts. Ask emergency services to bring an AED device as soon as possible. Immediately start giving high-quality CPR at a rate of 30 compressions followed by 2 rescue breaths. Continue this for 2 minutes or 5 cycles of chest compressions and rescue breaths. Once 2 minutes of compressions are done, check the patient's carotid pulse and breathing efforts. Repeat this routine till pulse comes back or till an AED device arrives. Let's suppose the emergency services arrive with an AED device, so what's next? Since you have been giving high-quality compressions till the EMS arrived, you are now exhausted, so the ideal thing to do is to hand over the compressions to the EMS, while you attach the leads of the AED machine. The AED device has 2 leads, one goes on the right shoulder below the clavicle at mid-clavicular line, while the other goes at anterior axillary line in the inframammary region. Once the AED machine is turned on, it will give further instructions to continue CPR or not, it will analyze the rhythm and assess whether it is shockable or non-shockable, and it will instruct to deliver shock if necessary. In the meantime, we will shift the patient to a center where he can get advanced cardiac life support or ACLS. Lastly, let's explore the key aspects of pediatric BLS, including the necessary adaptations to the standard BLS protocols, to ensure that you are well equipped to provide life-saving support in pediatric emergencies. For teenager, we can use the standard BLS guidelines as in adults. While for neonates and infants, the technique depends on the number of rescuers available. If only one rescuer is present, we will use the 2-finger technique. This involves using 2 fingers, typically the index and middle fingers of your dominant hand, to perform chest compressions. Compressions should be done at a rate of 100 to 120 compressions per minute and to a depth of about 1/3 of the chest. With the normal 30 compressions to 2 rescue breath cycles. If more than 1 rescuers are there, we can shift to the 2-thumb technique. The 2-thumb technique involves using both thumbs to perform chest compressions while encircling the infant's chest with both hands. Place your thumbs side by side on the lower half of the infant's sternum, with the tips pointing towards the infant's head. Compressions should be done at a rate of 100 to 120 compressions per minute and to a depth of about 1/3 of the chest. This technique allows for more consistent compressions and better depth, making it preferable when 2 rescuers are available. Here we will give 15 compressions followed by 2 breaths. Once intubated, each rescue breath can be delivered once every 3 to 5 seconds. That is it for today. Thank you for taking the time to listen to this video on basic life support. It is our hope that this knowledge can help you make a difference in an emergency situation. We will be back soon with more important topics. Until then, keep learning and stay safe.